Hi, today we are going to talk about the heart. The heart is one of the most important organs of the human body. Its main function is to get the blood flowing through all the tissues composing a human being. The heart is mainly composed of muscle, the myocardium. It is separated in 4 chambers, the left and right atria and ventricles. Blood always arrives to the heart in the atrium via veins. It is then pushed into the linked ventricle where it will be ejected in an artery to join the pulmonary or systemic circulation. The contraction of the myocardium is called the systole, while its relaxation is called the diastole. Every passage of blood between the atria and the ventricles, as well as between the ventricles and the arteries, is allowed thanks to valves that prevent blood reflux. Human heart rate oscillates between 60 and 100 contractions per minute, which means nearly 3 billion contractions throughout life. Thus, it is really important to keep a healthy heart with healthy valves. The valves are composed of several cup sides whose concave part is located against the backflow current, ensuring the opening during the passage of the blood and the closing during backflow. The left heart has 2 valves, the mitral and aortic one. The mitral valve is the left atrioventricular valve. It opens via a series of muscles forming cords, and it prevents the return of blood in the atrium when the ventricle is in systole. The aortic valve is located between the ventricle and the aorta and have an opposite orientation compared to the mitral one, allowing the opening during the systole of the ventricle and therefore closing during the diastole. Since these valves are so much solicited, problems can occur. Indeed, 10 to 15% of people over 75 years old are affected by heart valve disease. There are 2 main pathologies: chronic insufficiency and stenosis. The insufficiency is the inability of the valve to close during diastole. For example, chronic aortic insufficiency leads to blood going back and forth between the ventricle and the aorta. The ventricle must expel a larger volume in order to compensate backward circulation. Stenosis, on the contrary, is the inability of the valves to open properly during systole. Back to the left ventricle, stenosis reduces the area of the aortic valve, causing turbulences and the need for the ventricle to grow thicker in order to expel blood. In both cases, there comes a time where the heart is not able anymore to sustain the additional effort. Medication cannot cure heart valve disease, but they can relieve the symptoms. Most of the time, valve procedures are necessary and are designed to repair or replace one or more defective valves before they cause permanent damage to the heart. If a defective valve cannot be repaired, it must be removed and replaced with a mechanical or bioprosthetic valve. Mechanical valves are made of durable metal, carbon, ceramic and plastic. The main drawback is that the patients will have to take anticoagulants for the rest of their lives. Bioprosthetic valves come from animal or human. They are less durable than mechanical ones and often need to be replaced after 5 to 15 years. Experiments must be conducted to be able to enhance the properties of biological and mechanical valves. We are confident that computational methods are the answer in order to develop the best heart valve implant possible. Indeed, the implementation of models allow a large freedom of choice of parameters and a better understanding of valves' behavior. And you, what do you think? If you want to know more about the subject, if you are not convinced that computational methods are better than experimental ones, do not hesitate to come on May 8, 2020 to our debate. Thank you for listening and see you soon.